CMS offers a plan to cover CAR T-cell therapy, a study faults FDA's handling of fentanyl oversight, and breast surgeons call for genetic testing in all breast cancer patients. Welcome to This Week in Managed Care. I'm Samantha DeGrande. After months of speculation, CMS has a plan to pay for CAR T-cell therapy, but there's a catch. Every patient would have to be enrolled in a registry or a clinical trial and followed for at least 2 years. The coverage with evidence development model would generate data that CMS would use for a broader model that would not require patients to enroll in registries. Said CMS Administrator Seema Verma, this proposed coverage decision would improve access to this therapy while deepening CMS's understanding of how patients in Medicare respond to it, so the agency can ensure that it is paying for CAR T-cell therapy for cases in which the benefits outweigh the risks. But Dr. Joseph Alvarez, a hematologist-oncologist at City of Hope, told AJMC that while the data will be useful, the documentation requirements could affect patient access. Said Alvarez, it adds to the burden, and anything that adds to the burden increases the risk of disenfranchising some patients. For more, visit ajmc.com. FDA's program to block inappropriate use of fentanyl failed to prevent off-label use or keep it away from patients who are not already using opioids, a study reported this week. A study in JAMA and an accompanying editorial called for reforms of FDA's risk evaluation and mitigation strategy known as REMS. JAMA authors also criticized FDA for a 5-year effort to block researchers from gaining access to data and said despite weaknesses in REMS, the agency did nothing to fix the program. 5 years after the program began to monitor transmucal immediate-release fentanyl, researchers found the following. 39% of physicians reported prescribing the fentanyl class for chronic non-cancer pain. Claims showed that 34.6% to 55.4% of patients getting the fentanyl class were opioid non-tolerant, even though the class is contradicted. Authors suggested several reforms, including making a third party in charge of REMS. Guidelines issued last week by the American Society of Breast Surgeons call for giving every patient diagnosed with breast cancer a genetic test with a multi-gene panel. The consensus statement from the Society's Board of Directors has 5 elements. Breast surgeons, genetic counselors, and other knowledgeable professionals can provide education and counseling, make recommendations, and arrange testing. Genetic testing should be available to all patients with a personal history of breast cancer. Testing should include BRCA1 and 2, PALB2, and other genes consistent with family history. Patients who had genetic testing may benefit from updated testing. Genetic testing should be made available to those without a history of breast cancer who meet NCCN guidelines. Variants of uncertain significance are DNA sequences that are not clinically actionable. This type of result must be considered inconclusive. The statement is supported by a study published last year in the Journal of Clinical Oncology. Some payers have required genetic counseling with testing to avoid unnecessary surgeries. For more, visit ajmc.com. Diet soda is not as healthy as it seems, according to findings from the Women's Health Initiative. A study that tracked 81,000 women for an average of nearly 12 years found that those who drank 2 or more artificially sweetened drinks per day had a 23% higher risk of having any type of stroke and a 31% higher risk of having a stroke to a blood clot in the brain, compared with women who drank fewer than 1 beverage per week. Risk increased even for women with no prior history of cardiovascular disease or diabetes. Said study author Dr. Yasmin Mosavar-Rahmani, our research and other observational studies have shown that artificially sweetened beverages may not be harmless and high consumption is associated with a higher risk of stroke and heart disease. Finally, join us in Dallas March 7th when AJMC will hold its next session of the Institute for Value-Based Medicine. The session begins at 5:30 p.m. at the Four Seasons Las Colinas and features Dr. Roy Page and Barry Russo of the Center for Cancer and Blood Disorders, Lance Spivey of Stratify Health, Dr. Kashyap Patel of Carolina Blood and Cancer Center, Dr. John Cox of UT Southwestern Medical Center. For more, visit ajmc.com. For all of us at the Managed Markets News Network, I'm Samantha DeGrande. Thanks for joining us.